3, 2, 1.
My diagnosis for your condition is rheumatoid arthritis, Mrs.
Good
David.
morning. Morning. Please have a seat.
Thank you.
What's your name?
My name is Cindy.
Okay. Can you tell me what is your reason to come here?
Okay, I've been experiencing quite a bit of pain and swelling in my finger lately, and I'm here for physiotherapy treatment.
Okay, thank you for coming to me. So, I understand you were diagnosed with rheumatoid arthritis. Can you tell me more information about your symptoms?
Sure, it started pain and swelling about 6 months ago, and I take some painkiller for 2 weeks, but the pain still continue. And then I see the deformity and swelling in around my finger.
The sounds is challenging are often causing symmetrically swelling and stiffness in the joint, particularly in hands. Have you noticed at any specific times when is the pain or stiffness worse?
Yes, it's usually come in the morning when I wake up, and then sometimes it take a while to I have to bend fully my finger or make some fits.
Morning stiffness is a common symptom of rheumatic arthritis. It lasts maybe 30 minutes, unlike other types of arthritis. Have you been able to manage your daily activity or have they affected?
For daily activity, it's so difficult because when I do some simple tasks like writing or grabbing some object, it's so painful. And my finger sometimes is swollen like a sausage, which is it's so hard to hold something.
I see the swelling that you're describing is a type of rheumatic arthritis and can affect your strength and your grip. We will work on some exercise to help improve your function and maintain your strength. But have you been doing any exercise at home?
At home, not really, because when I move my hand, it's so hard, it's so difficult because with Spain, I am mostly resting.
Rest is important, but gentle exercise can also help maintain joint mobility and reduce stiffness. We can start with some range of motion exercise today and discuss home exercise program tailored to your needs.
That sounds good. I can wait, and I want to be able to manage my hotel without feel any pain or discomfort.
Absolutely, with consistent exercise and therapy, we can improve your function and decrease the symptoms over time. But before we let's begin with some assessment to see how we can help.
Okay, Michelle, let's go. Can we?
Let's see. Okay.
Okay, so before we do the therapy and exercise, I would like to assess several factors that will be served as our benchmark for our intervention later. So it's like pain, range of motion, and swelling. And the first we will go with pain. I will measure it by fast, and you can drag the fast needle according the intensity of pain you feel right now and the pain you feel when you at rest.
Right now, here, and resting.
Okay, I already report your pain scale, and now we will move next to the range of motion. I will use a goniometer for finger, and may I see your please?
Sure.
Okay. Could you please bend your finger, please?
Sure. Up.
Okay. For your finger flexion is it's about 20 degrees.
Okay.
Alright, and the last measurement is swelling. So to measure the swelling in your finger, I will use some line and I will compare the result with the finger in your healthy side. Okay. Okay. And the other side? Okay.
Okay, so now I will explain more about rheumatoid arthritis to you.
Okay, so rheumatoid arthritis is a chronic autoimmune condition. This means that your immune system, which normally protects your body, was mistakenly attached the lining of your joint, and this causes inflammation, pain, swelling, and stiffness. And this particularly in the smaller joint, like those in your hands and your feet.
Oh, I see, I see. Is it the same like regular arthritis?
Not quite. While osteoarthritis is caused by wear and tear on the joint over time, rheumatoid arthritis is due to your immune response, and it can occur at any age and might involve fatigue, fever, and can affect the other parts of your body.
Ah, that makes sense. Uh, will it take a long time to see the improvement?
It varies from person to person. Some people feel better after a few weeks, and the others might take longer. The consistency is a key, and I'll get you to every step to ensure your treatment is safely and effectively.
Okay, Fisher, thank you for explaining. I feel hopeful right now.
You're welcome. Now I'd like to talk about the plan for your treatment. So for the short term, our goals is reduce the pain and inflammation. The second one is to improve range of motion, and the third one is to prevent further deformities. And for the long term, we aim to maintain your functional abilities to do your daily activities as usual.
Okay, Fisher, I will do it my best.
Okay, good morning, ma'am. Today I would like to apply the aspect to your finger joint. Have you ever heard or ever tried the aspect before?
No, I have not. But my heart often hurt, and I know how to do relieve the pain.
Okay, I will apply the aspect to your finger joint. The goal is to reduce the pain and inflammation. We will do this 20 until 30 minutes per session, and ideally it should be done twice a day, in the morning and the evening. Does that sound comfortable?
Yeah, sure.
Make sure not to apply the ice directly. So we use the thin layer like the towel or some sheet of fabric to wrap the ice pack. Also, if you feel tingling or excessive discomfort, please tell me right now.
Sorry if I feel it's not comfortable.
Okay, let's try that. Okay, do you feel comfortable?
No, I'm fine.
Does it feel more better?
Yeah, less pain. I feel less pain than
Okay.
before.
Okay, next I will be using TENS to help reduce your pain in your finger joint. The device works by sending the mild electrical stimulation through electrode that we place around the ventral area, especially in your finger joint. Have you ever tried this treatment before?
No, I haven't tried, but I'm so curious to see how it works.
TENS is quite simple. I will place two electrodes around your ventral area. After that, the device will deliver light electrical stimulation, which help relieve pain. Each session will last for 15 minutes. How does that sound to you?
That sounds good. And anything else that I should know?
Just remember during the session, you may feel mild sensation, but if it become uncomfortable or too intense, please tell me now.
Okay. I will tell you if I feel not comfortable. And thank you, Physio.
You're welcome, Miss. I hope it helps reduce your pain. Let me set up the electrode, and we will begin the first session.
Okay.
Next, I will get you through some exercise to help improve the function and reduce the pain in your finger joint. We will start with stretching exercise. The stretching exercise is metacarpophalangeal flexion. The exercise is you can bending your finger to flexion like this. Do 5 repetitions, and per session you can hold 5 seconds. 1, 2, 3, 4, 5, and release. Again.
Alright, Physio. And what the next exercise?
The next exercise we will do the strengthening exercise. the strengthening exercise, you can do the pinch grip. So the pinch grip is you can pinch the something between your thumb and your index finger like this. You can pinch, also do 8 until 12 repetitions. Okay, during the exercise, make sure you don't feel excessive pain. If you experience pain, take a break and let me know. Try to do this exercise regularly to get the best result. And don't worry, we also prepare the home program for you, so you can do this at home.
Good to hear that. Thank you, Physio.
Thank you.
After we are doing all of the intervention, now we're going to talk about the home program. So you still can do exercise at home. So the first is during mobilization exercise. So you have to flexion and extension your finger. So like this, open and close your finger and do it for 10 repetitions. Okay, second we're going to do strengthening exercise. So the strengthening exercise wearing a soft ball. You have to squeeze the soft ball gently and hold it for 5 seconds. After that you can release. Like this, you can hold the soft ball. After that we're going to do the stretching exercise. So the stretching exercise, using your hand, you put your hand flat in the table and stretch with your underhand like this. Hold that for 10 seconds and release. Do it in every finger. Did you still have any question for the program?
No, I understand. Thank you, Physio.
So after that, we're going to do the evaluation as your process after we are doing the intervention. For the evaluation, we're going to do pain using a fast, then range of motion using volumeter, and swelling using a midline. Okay, lastly, before we end our session, I'm gonna suggest you some education. So first, you still have to using your NSID for this pain and inflammation, but you still have to know about the side effect using NSID, like gastrointestinal issues. And second, you have to maintain healthy diet and eating anti-inflammatory food like fatty fish, green leaf, nuts, and berries. But and you have to limit eating processed food, excess sugar, and red meat because that food can increase your inflammation.
Okay, Physio. Thank you for your information. I'll do it the